This conference will now be recorded.
Hello everybody and welcome to Care for Each Other Infopoint. Today I'm joined by Beth Kimberley, who is the Partnership Manager for Remploy Access to Work Mental Health Support Services. Remploy is partnering with NLAG to provide a comprehensive service for our staff and our managers to support with staying well at work. So she's going to run us today through some slides. I'm going to ask some questions and then we're going to have some contact numbers and hopefully this will give a precise and concise view of what the service does and what it can offer and how it can support all of you. So good morning and welcome, Beth.
Thank you, Rachel. So yeah, as introduced, my name is Beth Kimberley. I'm one of the partnership managers, and it's my job to make sure that all of you employees are aware of the Access to Work mental health support service, specifically, the purpose and aim of the service, the eligibility and referral process in order to access the service, and also the service structure, potential interventions and support that's available for you on that programme. So that's the detailed overview that I'm going to give you today. So for those of you who aren't aware of Access to Work in general, so Access to Work are a Department for Work and Pension scheme who are available to anyone that's based in England, Scotland and Wales to support them with making the workplace more accessible to them. So that could be assistive software, travel to work, adaptation to premises, or mental health support when it comes to the Access to Work mental health support service. How the Access to Work service usually operates is that they provide a grant for support within the workplace. And as mentioned, that's to support you to stay in work long term. So when it comes to mental health, Access to Work fully fund Remploy to support eligible employees to get 9 months vocational mental health support, which is designed to help people to overcome workplace related barriers that are there because of their mental health or stress, and help them to stay in work long term or even return to work if they've been signed off unwell. So the first thing to know about the service is that it's completely vocational. So we're not a counselling service. We're not there to treat a mental health condition itself, nor are we there to not there to treat the condition or the illness, but we're there to look at the vocational challenges and help people to overcome them with effective coping strategies, reasonable workplace adjustments, and advice and guidance over a 9-month period. The support, therefore, does not look to replace any occupational health services or an employee assistance programme that I know you already have in place and that Rachel will touch on further into the presentation. But we're not there to replace any of those services. We're hopefully there to complement those services and provide that vocational element of support to you. The support is also completely confidential. So when you refer through to the service, because you're trying to get support in the vocational setting, we do always encourage that you allow us to speak to your employer. That could be your line manager, an occupational health advisor, a HR representative that's supporting you. But we're under no obligation to reach out to those parties until you are happy for us to do so. So it's confidential until you state otherwise. It's available to employees who have either a mental health condition, diagnosed or undiagnosed, or feelings of stress, to help retain or regain their ability to participate in work. So that's individuals within lots of different sectors. So we do help a lot of NHS trusts, and we've recently partnered up with your trust to ensure that you're fully aware of the service and know how to access this service, as it's something which, once you've listened to this presentation, that you could access straight away once you've found our details. We've helped thousands of people since it launched in 2011. So as mentioned, our main aim is to help people to stay at work and to help them to get back to work. And we actually have a 93% rate of doing that, so a retention rate. So the support that you will receive from our vocational rehabilitation consultants is proven to help people to stay in work long term. So
Sorry, Beth, can I just ask a couple of questions there, please?
Yeah,
Um,
sure.
so, um, you mentioned there that the service is accessible for people with a mental health condition or mental health illness or feelings of stress. So I know you had said diagnosed and undiagnosed, but sometimes it is hard for individuals to recognise that the feeling of just stressed or being overwhelmed at work is a mental health condition. So I just want to make it plain to our staff that if you are just feeling overwhelmed or with the current situation with COVID or in work in general, or you're feeling stress and that stress is from outside pressures but affecting you at work, that absolutely that any member of staff feeling like that can access the service. Because sometimes it is hard for us to say, I've got a mental health condition. We don't expect you to say, I've got a mental health condition, or to recognise that through a GP. But if you're just feeling overwhelmed at work, what we want you to do is access this service before it gets too much and you have to take some sick leave, so that we have that support there for you to ensure that we can stay well at work and put some interventions or coping mechanisms that help you just with the everyday stress that lots of us are feeling at the moment or continually.
Yeah, that's exactly right. So it's not necessarily that you have to have an undiagnosed condition. At the moment, we appreciate that people are feeling extremely overwhelmed from the effects of the current pandemic and things like that. And there's a lot of external triggers that can affect your mental health. So it is about taking those early intervention steps into getting in touch with us and just kind of self-reporting to us that you are feeling a little bit overwhelmed, that you've got poor mental well-being is probably a better term for it, rather than poor mental health. So on the eligibility slide in a moment, I will give you a couple of examples of different scenarios and things so that you can put it into context. So our vocational rehabilitation consultants that deliver this support, they're based all across the UK, all across England, Scotland and Wales, and you would receive the same support from the same VRC for the whole 9 months that you are on programme with us. So it's not the sort of service where you call up and speak to a different person each time. You would have a dedicated consultant who would support you on that journey. And there's no financial contribution to be made by yourself or by the employer, which can sometimes be a barrier to accessing support. But with this programme, as long as you're eligible, and I'll be talking about that in a short moment, then you will be able to access this fully funded support. It's not even a case of paying up front and claiming it back. If you've ever worked with Access to Work before, you'll know that sometimes they require the employer to part fund something if they're a large organisation, or you may have to contribute some money towards your taxis to work. But with this service, it is all fully funded and it's not means tested in any way.
So Beth, that's really interesting, because what we're offering and what Remploy is offering now seems a huge amount of support. So up to 9 months of support, and longer if required. And I know as we get into the slides, we'll be talking about how you will interact with other services. And it seems kind of too good to be true that this will not be funded by the trust or any department, but I want to reiterate that to our staff as well. There is no grants, there is no cost whatsoever to the trust or to your department or the individual. It is all funded through the Department of Work and Pensions. There's no forms to fill in, because we're very used to filling forms in the NHS to achieve or access any money. It is solely down to Remploy to deal with all the finances.
Yeah, so it's all taken care of directly between us, the provider, and Access to Work themselves. So you don't have to worry about any of that, which, as mentioned, it just makes it really accessible for you. So onto the eligibility criteria, and there's 2 strands to this criteria. So the first thing is that you do have to be in paid employment. So you have to be in paid employment either with the trust or with an organisation that's working with the trust. So you could work for an agency, you could be bank staff and things like that, and that'd be absolutely fine. It also doesn't matter how many hours you work. So if you're on a permanent contract or a 0 hours contract, that's absolutely fine. You may also be a self-employed contractor or something like that, and that is also okay. Or you may be attending work or signed off sick. So this can, in some ways, be used as an early intervention tool. You know, you could have just started a new role and you would like, you know that you've struggled in a previous role and you'd like to get some proactive support in place. Or you actually may have been signed off work for a long period of time and you may require some help to return to work. And it doesn't actually matter how long you've been signed off work for, as long as you've got that contract of employment to return to. So you may have been off for, it's not been uncommon. I've worked as a VRC myself, and it wasn't uncommon that someone would be off for over a year or even up to 2 years, but they had that contract of employment to return to, and we helped them to return to work. The second piece of criteria is that you have to have a mental health condition or symptoms. So when we say symptoms, that goes back to what we mentioned a moment ago, where it can just be poor mental well-being or feelings of stress. You know, we're not expecting you to go to your GP at a later date and get that diagnosis or anything like that. We just need you to self-report that you are struggling at work because of your mental well-being or feelings of stress. So the fact that you don't need a diagnosis is something, again, which differs from the wider access to work scheme. So the wider access to work scheme, say you needed taxis to work or a support worker, for example, they may require some medical evidence in order to get that support in place. But with this programme, it's all done on your self-reported challenges. So as long as you are facing some challenges within the workplace, then we will be able to support you on the programme. Mental health.
Sorry, Beth, can I just ask a question there? So I know
Sure.
you have planned to do a specific recording for our staff that are shielding at the moment, and for some time in the future, how we will support them and Remploy will support them in returning to work. But at the moment, we have staff that have been working from home, and they might just be anxious about returning to the workplace as we sort of return to the new normal. And absolutely, Remploy is there to support them to do that. And that any one of our staff that's working at home at the moment and feels anxious about returning to work, this is the prime time to reach out to Remploy, who will be able to help you transition back into the workplace, whether you're coming back full-time or part-time. We recognise as the trust that that's going to be an anxious time. We've got so many new rules and regulations, and whether we're wearing masks or not masks, and so all that information is out there for our staff, that is put together by our internal teams. But Remploy are there to ensure that they support you with that anxiety.
Yeah, that's correct. So we appreciate that many people are having challenges that are, at the moment, the triggers are very much not linked to the workplace. That relates to the last point on the slide here, that you know, we appreciate that it's not always work that is the issue. You know, you might actually usually find your duties and responsibilities quite manageable and things like that, but because of the current circumstances and the fact that you might be returning to work from, you know, furlough or working from home or a period of sickness absence due to the stress of the current situation, you know, that's absolutely fine, and we fully appreciate that, and that, you know, it doesn't have to be caused by work. A lot of the time people will call us up and say, you know, my employer is really supportive, I really enjoy my job role, but for whatever reason I'm really struggling to cope at the moment and to come and to kind of manage those feelings associated with returning to work, or just managing that working day if you're still attending work. Mental health.
So Beth, sorry, can I just ask then, if somebody's partner had been made redundant, and that was causing some anxiety or some financial pressures within the family, so absolutely not connected to NLAG or their work, but was making the staff member feel anxious or that feeling depressed, we can still reach out to Remploy then, yeah?
Yeah, so it just has to be affecting them in work. So someone could be feeling
Yeah.
overly anxious and depressed because of that situation. And as long as there's kind of saying to us, that's affecting my ability to focus at work or whatever it might be, affecting them in some way, then we could help. The situations where we can't help is where someone reports to us that perhaps they're having lots of challenges outside of the workplace, such as the ones you've just mentioned. So redundancy, you may have gone through a recent bereavement, or having those financial challenges, but it's not affecting you at work. Actually work is your escape from all of those things. For example, that's the only time when we wouldn't be able to support someone, because there just needs to be that effect on the workplace, if you understand what I mean there.
Absolutely.
Yeah, so the only other thing to mention on point 2 here is that often mental health is not someone's primary health condition, and that's absolutely fine. So you may be feeling, anxious or have a low mood, even as a result of another health condition. So an example that I use here is I previously supported a lady who she came through to Remploy because she'd been signed off work for in excess of 6 months because of a sudden onset of symptoms in relation to her Parkinson's disease. And she was actually managing those symptoms quite well, but what was stopping her from returning to work was the anxiety around having to reapproach the workplace, having to explain to her colleagues about her condition, which I don't think many of them was even aware as to why she'd been off. And she was extremely worried about how some of her symptoms in relation to Parkinson's was going to affect her at work, and that included a stammer, which was related to her tremors and things like that. She'd also had her driving license removed, so it was difficult for her to get to work. So some of the things that we did, just to kind of put it into context for you, is we firstly reached out to employer because she gave us consent to do so, and we put a plan, we put a bit of a narrative in place which the employer could send out to colleagues on the week before this individual was returning to work, and it was all in the individual's own words, explaining kind of what she'd been through over the last 6 months. I know it's not always the done thing, but it was something which really helped this individual to ease back into the workplace. We then got some adjustments in place for her in case she was to need to come off the phones. She mainly telephony based. If she needed to come off the phones, she had a signal which she could give to the line manager to come off with no questions asked, to ensure that her symptoms wasn't exacerbated in that moment that she needed to come away from the phones. And we also ensured that she got some taxis to work via the wider access to work scheme. In addition to that, we got her in touch with her local Parkinson support group. So if there is something that's going on which is not so much mental health related, we will try and help you to get in touch with relevant organisations that specialise in that as well. So as part of your support plan, we may advise that you speak to a local support group and help you to get in touch with them and things. And I'll talk more about that on the intervention slide, but it's just an example there of how this person's mental health wasn't their primary health condition, and the triggers weren't really linked to the workplace. She didn't go off work because she had a problem with work. She went off work because of something quite external, in relation to her long-term health condition. So it's quite an holistic service. We try and look at things from all areas, but the main thing is that you do have to be struggling with your mental well-being, and it does have to be affecting you at work.
So that's really interesting, Beth, and I just want to expand or clarify, really. If a staff member accesses your service and you put together the wellbeing plan or an action plan, and then there's some adjustments, reasonable adjustments like you just spoke about, will Remploy then help that staff member and the manager understand what's going on with that staff member and come to solutions that suit and support the staff member, but also support the service needs as well? So it's quite sometimes it's hard if you get a report that just says these are the reasonable adjustments needed, and for a manager to translate them into practicalities. And is that something that you will do, obviously with the staff members' consent, but support the managers and the staff member to ensure that they've got a plan that suits everybody?
Yeah, so as soon as we've got someone's consent to engage with the employer, we want to come in and support all parties to get a long-term sustainable adjustment in place. So not just something that can be sustained by the employer by the short term because it's perhaps a little bit unreasonable, but something which suits everybody. So I can give you another example of this, of somebody that I previously supported. And it was actually within an NHS trust. So this person was responsible for delivering 20-minute clinics back to back throughout the day with a half-an-hour lunch break. But because of a physical health condition, which included fibromyalgia and quite severe anxiety, occupational health had suggested additional breaks. But like you say, that was left for the manager to translate. Okay, what does that actually mean? It wasn't a tangible request. So we kind of came in and sat down with the line manager, again, with the individual's consent, and broke that down. So we asked what the individual felt that they needed, and they actually said, I don't think I need proper breaks where I'm, sat in the break room. I just need 20 minutes per day in the morning and in the afternoon, away from patient facing activity. So I could help with some admin. I could, move some things around departments or whatever it might be. So I'm still contributing to the work levels, but I'm just not patient facing. So until we had this meeting, that wasn't clear what the individual actually wanted themselves, and that suited the line manager much better, as they was quite anxious about giving this individual additional breaks and how it was going to affect the flow of the working day. So I think that's an example of kind of meeting in the middle, and the VRC is very much there to do that. They're there to facilitate and help with that conversation and provide their advice and guidance on the situation. So yeah, we're very much there to support both parties, but as mentioned, and it's only when the individual allows us to do so.
Brilliant, Beth.
So
I think that's great.
Fantastic. No, it's okay. So the referral process then. So if you're listening to this and thinking, this service is exactly what I need, that helping hand through each working day, somebody to help me engage with my line manager and to follow up on a long-term plan, then you can self-refer to the service, and you do that by calling the confidential helpline, which is 0300 456 8114, or using the email address below, which is on all of our marketing materials. And I'm sure Rachel will be able to expand a little bit on where you'd be able to find this information within your trust.
So absolutely. So all staff will have known over the last 10 weeks or so, we have been through Peter's daily email and updates on the hub, putting out information around the services and wellbeing offering we have. So we by now staff should know that we've got our Care for Each Other campaign, which has its own hub page, and on that hub page you will find this video, which I'll put there for everybody to see, plus the posters and the comms that have gone out around Remploy and the new services that we're putting in place. You will also find these on the wards and in your areas when we distribute some posters, and our HR teams and our occupational health teams have had sessions with Remploy and have all the information to help staff if you are a bit unsure about which way to get referred into Remploy. I think it's really important also for our staff to know that Remploy has been working with myself and our other partners at Navigo and RDash and our new employer assistance platform, VivUp, really closely over the last couple of months to ensure that Remploy know all the services that are on offer here in the locality. So when we go back to the beginning of the slides, and Beth was saying that the VRCs will then manage your plan and they'll refer you on to counselling. They're fully aware of Open Minds and the Talking Shop, and we will have regular meetings as partners to make sure that the VRCs are kept up to date with any services that they need to access for our staff in our locality. So that should give the staff the comfort of that if you use one service, like going to Remploy, they will interact and support each other with all the other services, and will know that Navigo and Open Minds have the counselling service here in Grimsby. They will know that if you have a physical health condition, that the occupational health team in NLAG are here to help, or refer you to our physio programme. So this hasn't been put in isolation, and all partners will be working together really closely from here on in to ensure that our staff have real clear and supportive pathways.
That's great, thank you. So when you do reach out to us and call that number, the first thing that you'll do is you'll get through to someone from our support centre in Leicester who will take your referral details. So this first call isn't to offer support as such, it's not a crisis line, but what it is there to do is to take your details, gain a bit of insight into your current challenges, and assign you then to your local VRC. So some of the things that they'll ask is a brief description of your job role, duties and responsibilities, a description of your mental health concern or feelings of stress or poor mental well-being. We'll get an insight into how that's then affecting you at work, and is your employer aware of these challenges? Have you even disclosed that you're struggling with them? Have any adjustments been put in place? So on the other side of things, they may be fully aware, and actually everyone's been trying to get some support in place for you, and we may be able to come in and give a helping hand with that. And we'll always ask the individual if they have an idea of what they need. So this is a very employee-led programme, so it does require you to engage with us for the 9-month period, and we always take your kind of insights on board, and we will of course try and help where it's reasonable to get those things in place for you. At this stage on the call, we will need national insurance number or individual learning record number for apprentices. So apprentices and employees will receive the same level of support, but we just require kind of different forms of identification from them. So if you could have that available on this first call, that would be much appreciated. So once you have spoken to somebody within our support centre, the first thing that they'll do is they'll assign you to your local VRC. So VRC, to remind you, stands for Vocational Rehabilitation Consultant, and they're based all across England, Scotland and Wales. They're all outreach workers, so we will come to you in order to complete your first appointment at a location of your choosing, and I'll talk about that in a little moment. So the first thing that the VRC will do is contact you to complete a telephone assessment. So the telephone assessment isn't so much an assessment because you've already assessed that you're eligible for the service to get this far, but it's getting to know you a little bit more, and it then helps them to develop an individual support plan. So an individual support plan, I do actually have a copy and I can show you during this presentation what one of those looks like, and it lays out all of the support that we recommend. So that could include self-help resources, reasonable adjustments, return to work plans, signposting to other provisions, and agreed level of contact between us. That support plan is sent to Access to Work, just to say this is why we need to support this person and this is why we require your funding in order to help them for the 9 months. However, we don't send that across to them until you have approved it in your first face-to-face meeting. So in the first face-to-face meeting, which takes place at the very latest 30 days from when you first called us up, we will go through this report with you and start to discuss if you're happy with some of the recommendations which we think are going to help you over the 9-month period. And it's in that meeting that your 9-month journey begins. So it doesn't begin from when you first called us up, because you're obviously not receiving much support within those first couple of weeks. It's a lot more signing you up to the service. So the first face-to-face meeting is where the 9 months begins. During that meeting, you can bring whoever you like along to it. So you might want to bring a line manager or a colleague or a family member, and it can take place at a location of your choosing. So that could be the workplace. You might want to book a private meeting room. It could be a local coffee shop. It could be your home address or a more mutual location. Remploy also have a lot of office sites around the country. So if you wanted to come to an office environment, then we could also try and arrange that for you as well. In that first face-to-face meeting, we'll then schedule fortnightly review calls with you so that you know when they're all planned, and then we'll schedule a 6-month review meeting so that we know what we're working towards. So that 6-month review meeting will be to review how things have gone over the last 6 months, what's worked well for you, perhaps what you need to continue working on over the next 3 months, or do we need to put in a few more calls to your manager to discuss some adjustments, or do you need to still get in touch with that local support group or debt management company or whatever it might be. We're there to kind of encourage you and follow up on things throughout the whole journey. So it's at that 6-month stage that we'll do a full review of that. However, as mentioned, we will be speaking on a fortnightly basis throughout your whole journey. And we'll allow for an additional meeting between the 1 and 6-month stage. So it's that additional meeting that's flexible, and it could be 2 months in, it could be 4 months in, it could be 2 weeks in to the journey, and it's up to you when you use that appointment. And it's not a mandatory appointment either, so you might prefer to speak to us over the phone. At the 6-month stage, we assess whether or not you're ready to move to be transferred to our online support team. So if you're someone which is actually coping really well within the workplace at this stage and perhaps doesn't require the fortnightly review calls from your VRC anymore, then we'll move you to our online support team, who will contact you on a monthly basis, just to check in, to check that everything's going okay. And if for whatever reason it's not, the VRC would come back into the picture and start supporting you. However, if you are somebody that is still very much within needs 3 months extra support with their VRC, the VRC will continue to support that individual. However, it is still on a light touch basis, as a monthly basis, as that's the point where the support is phasing out, because at the end of the 9 months is where the support concludes. And at that stage, we'd be recommending that you access perhaps different services if you needed some, say, more clinical support or something and you haven't accessed it up until that point. But if you are somebody that does require more support from Remploy for whatever reason, access to work just require for there to be a change in circumstances of some sort. So of course, if in the last 2 months of your support period you've just changed job roles and it's exacerbated your feelings of anxiety, for example, of course we could speak to access to work about getting another period of support to support you in that new role. The same goes for if you've been diagnosed with a new condition, or perhaps something's happened in your personal life to mean that you're feeling a little bit different at work. But it is all subject to application to access to work at that stage when it comes to a second period. So on to the support and intervention. So when someone's on programme with us, everybody's journey is tailored to them. So although you're all receiving 9 months support, you get that meeting within 30 days at the beginning and the fortnightly calls, what you do on those calls is likely to be very different to a colleague accessing this service, as it's all tailored to you. So just to give you some examples, if you're somebody that's perhaps still getting to know your mental health condition, if there is one, and you require someone to help you look at early warning signs, triggers for your mental health and how you respond to those triggers, and that's where we might look at a wellness recovery action plan to help you get some interventions in place for when your symptoms start to appear. We will also look at psychological well-being and self-esteem. So we do that at the start and the end of the journey. And obviously, if someone's self-esteem appears to be low, we will look at some kind of confidence coaching throughout the journey, and that could be something that's stated on your support plan. Remploy also have an online wellbeing platform which anyone that comes onto the programme gets access to. So instead of us kind of emailing you some different ideas or giving you some handouts in a face-to-face meeting, although we can still do that, what we can also do is advise you to look on the platform in your own time. So you could look at it at the weekend, you could look at it late in the evening, or whenever you're finding that you're struggling. And it's got all of our mental health and stress related resources on there. It's also got great tools for goal setting. It's got healthy recipes and lots of stuff to support with overall well-being. At the bottom on the left here, you can see employer guidance for reasonable workplace adjustments. And I've already given you an example of how we might work closely with your employer to get some reasonable workplace adjustments in place if they're required, or if something's already been recommended by occupational health or other parties that you might be working with for support, then we can be that person that comes in, meets with your line manager, or even just speaks with yourself to get some of those adjustments and recommendations in place which someone else may have recommended previously. If you are somebody that requires additional access to work support, then we're somebody that can liaise with Access to Work on your behalf and make suggestions for what it is that you might require. So, for example, you may have a neurodiverse condition, and we know that Access to Work provides strategic coaching if a neurodiverse condition is affecting somebody from completing their day-to-day duties. We could speak to them about that. Or like the example I gave with the lady who couldn't drive to work anymore because of her Parkinson's, we spoke to Access to Work on her behalf to get some taxi funding in place. So we will engage with the Access to Work's wider service where required. We will also, on the original support plan, we will put some signposting on there to other organisations if it's required. So that could be in the form of something more bespoke, such as cruise bereavement or step change for debt management, or it may be signposting you to things which are within your organisation already that you may not be aware of, or may not have been aware that it was the type of service that you required. So I know Rachel's already mentioned some of these services on the referral slide a moment ago, but I don't know if you want to add anything here.
Yeah, so that's really interesting that it links back to all our services working together. So we'll see there when it says signposting employee assistance programs. So part of the new offering is we've partnered with VivUp. Now, some staff might have already signed up to the employer assistance program platform, and any NLAG staff is entitled to do that, and that's free of charge, and that will give the lots of help and advice there, and that has support for physical, mental and financial well-being. There's a 24/7 helpline there for crisis, but also links to sessions for counselling, and has some CBT workbooks. So the VRCs will be aware of what advice and guidance is on our EAP, and they will be able to help our staff signpost them to actually that's the place where you should be. So as Beth said, you might not know it at this moment, but that could be at your fingertips and the VRCs will help you identify that. One of the questions that I would have that come out of this particular slide is Remploy doesn't have to be the first port of call. So you might already be on the employer assistance platform, and you might already be having counselling from Navigo or RDash. That doesn't mean to say that you can't as well access Remploy, and they will all work together at any stage of your journey to make sure that you have the best clinical and supportive outcomes. So don't feel that at the moment, if you're already gone to VivUp and and you've already done the CBT workbooks on VivUp, or you're in the middle of counselling with Open Minds, or you've finished counselling with CIC, that you can't access Remploy. That doesn't apply. Remploy is still there to support you.
Great, thank you. So on to the next slide, and this is just a quick slide just to show some of the examples of some of the common things which people might report to us that they're struggling with. So it could be dealing with change. I mean, definitely at the moment, everyone's had to adapt quite quickly to a new way of living. You know, dealing with change, people might have found difficult. And we've got lots of, well, the VRCs have got lots of things in their toolkit to help you to self-manage that. Communication and working with others. So sometimes people will call us up and they might have had a breakdown in communication with a colleague or a line manager that's actually exacerbating their symptoms. We can support with that. Although we're not there in a union capacity, you know, we can help with the well-being side of things for you. Time management, taking instructions, relaxation and fatigue management, management of treatment and medication. So under that as well comes, you know, you might have started taking some, accessing some regular counselling sessions, and you may have found it difficult to perhaps get some time off work for it, and you're perhaps worried how to approach that conversation with your employer. And you know, we can always try and help you to have those open and honest conversations with people within your team. Mood and behaviour management, anxiety and stress management, and not just anxiety and stress management, but we can also help with, again, like raising awareness within the team. So most people are aware of anxiety, depression, and the more commonly disclosed mental health conditions. However, there are mental health conditions that people have less knowledge around, and you know, we're happy to give information to your immediate team and your manager to help raise awareness there as well. We've just got a little bit of feedback here from some of our customers. So the first quote is from an apprentice. So we worked together to decide what I needed to do to manage my depression and anxiety moving forward. This included keeping a mood diary, which I've been doing, and establishing methods of coping when I felt overwhelmed. And then there's another referral below where it says, I was used to referrals taking a long time, so it was refreshing that within a week I'd received a call from my vocational rehabilitation coach, Wendy. She helped me to liaise with my employer to make my workload more manageable, make them aware that there would be a recovery period, and talk about adjustments to help me in my role. So the support there they felt had been invaluable. So it's I think that kind of just shows that the support is different for everybody, and everyone's experience is different. So just to give you a quick recap then, so my aim was to provide you with a detailed overview of the Access to Work mental health support service for employees and apprentices. I defined the purpose and the aim of the service, which is to help people who are struggling at work because of their mental well-being or stress to sustain in work or return to work if they've been unwell. In order to access the service, you have to be in paid employment and be struggling at work because of your mental health, and that can be alongside another health condition, and it can be triggered by external factors. And the service structure is 9 months support, which is 6 months more intense support from the VRC, and usually 3 months light support from our online team. And the support and interventions are really tailored to the individual's needs and trying to encompass all the support that's out there for you without overwhelming you too much with too many programs, but kind of assessing what's right for you at that time and getting you in touch with different people. So I don't know, Rachel, if you've got any questions that you think people might have. I know we've spoken before about a Q&A kind of sheet further down the line.
Yeah, I think that would be really helpful, Beth. One of the things I just wanted to touch on was, and I really hadn't clocked this before, but I think will be really useful for our staff at all levels, is you've just mentioned that anxiety for staff can come out of a breakdown of communication with managers or team members, and Remploy and the VRCs can help deal with that and help you cope with that, but also help talk to your managers or your teams if you want them to help you rebuild relationships, or to, and I understand they're not a mediation service, but to give some strategies to teams or managers or individuals in how they can deal with sometimes those difficult situations that are really hard to broach and get to the bottom of it. And I think that service is something that will be really useful to a lot of employees, especially now when people are returning to work when they have been working from home. So you're coming into a new situation again with teams that are now diverse and working remotely, and communication can be difficult at those times, and that can cause some anxiety. So for me, knowing that Remploy will help with those anxieties is really reassuring.
Yeah, definitely. So we can support with engaging with you. Like, it's not always about reasonable workplace adjustments. Sometimes it is just helping you to break down those barriers that might be in place between you and your line manager or your colleagues for whatever reason. And yeah, you're right in saying that we're not a mediation service, so we're not there in like a union representative capacity. But again, they're another party that we could work alongside, and we could all be in a kind of meeting together to discuss your well-being and to make sure that everyone is on the same page and supporting you to the best of their ability. I'm going to leave my my details on the screen there for you, but just a reminder that this is something which people are already accessing at NLAG, and you could access immediately from today. You know, you don't need to go and get any kind of funding confirmation or anything like that. It's something you can access immediately. So it is the number that's on the screen here rather than my number directly. So I'll leave that there for you, just to take a note of that now that you're at the end of the presentation if you need it. Okay, thank you very much.
Thank you, Beth.